Chronic kidney disease can result in permanent damage of the kidneys, even eventually resulting in kidney failure, which is when the kidneys become unable to excrete wastes and properly control the level of fluid in the body. This usually results from the destruction of the nephrons. Even with kidney failure, however, there are still long-term treatment options available like kidney dialysis, kidney transplants, and even comprehensive conservative care. There are two main kinds of kidney dialysis: hemodialysis and peritoneal dialysis. Both types of dialysis allow people to continue to live without their kidneys. Dialysis filters out toxins, wastes, chemicals, drugs, salts, and extra fluids, preventing them from building up to unsafe levels in the body. Dialysis also helps control blood pressure to some degree and can prevent heart problems caused by a struggling kidney. Hemodialysis involves passing the blood through an artificial kidney, aka a dialysis machine. The blood passes through thousands of fine tubes made of a differentially permeable membrane and immersed in a bath of fluid. The fluid contains glucose and other substances at concentrations similar to those found in the blood, but without wastes. Since the fluid has no waste, a concentration difference is created, meaning wastes will diffuse out of the blood and into the fluid. The clean blood from the hemodialysis machine is then returned to the patient. The peritoneum is a membrane that lines the inside of the abdominal cavity and covers abdominal organs. It has a very rich blood supply, which is great for effective dialysis. Peritoneal dialysis occurs inside the body, using the peritoneum as a membrane across which wastes can be removed. A tube, called a catheter, is surgically placed through the wall of the abdomen. For an average adult, 2 to 3 liters of dialysis fluid are passed through the catheter into the abdominal cavity. Wastes will diffuse out of the blood via the peritoneum and into the fluid in the abdominal cavity. After wastes are removed, the fluid that was placed in the abdominal cavity is drained out through the catheter along with any other wastes and extra water that have diffused out of the blood. There are many differences between hemodialysis and peritoneal dialysis, some of the main ones being the amount of time spent attached to the machine, how easy it is to do at home, and if the dialysis occurs outside the body or inside the body. Hemodialysis must be done at least 3 times a week for 4 to 5 hours, while peritoneal dialysis is done daily for shorter periods of time. Hemodialysis is usually done in a hospital as it is more difficult to do at home, while peritoneal dialysis can be easily done from the comfort of your own home after a bit of training. In hemodialysis, the diffusion of wastes occurs outside the body, while in peritoneal dialysis, the diffusion takes place inside the body. Another long-term alternative for people struggling with kidney failure are kidney transplants, when a healthy kidney is transferred through a surgical operation to a person whose kidneys are no longer working properly. A successfully transplanted kidney will eventually grow bigger in size to compensate for the lack of a second kidney. Only one working kidney is necessary to live a healthy life. While a kidney transplant may seem like the universal solution or a scary option to consider, there are still many pros and cons to getting this treatment. Most patients feel a kidney transplant improves their quality of life. A kidney transplant means a dialysis-free life, and the operation is relatively quick, usually taking 2 to 3 hours. The downsides are the wait list for a deceased donor kidney is about 3 years, so unless a family member or friend is a match for donation, a person needing a kidney transplant may have to wait up to 3 years or more. If a new kidney doesn't work right away, a patient may need dialysis for a short while until it does. A person who has a kidney transplant will need to take medicine for the rest of their life to prevent their body from rejecting the new kidney. They will need regular checkups to keep their kidney health in check, and the anti-rejection medicine weakens the immune system and in some cases can alter mood.